Well, thank you, Chairman. Well, time is usually short in such sessions, so I think we can all agree that bile leakage after a partial liver resection is a major complication after surgery because the following secondary complications like abdominal sepsis or liver failure are usually associated with poor outcome. We know much about treatment and management of this postoperative complication, but however, less is known about the actual impact on liver regeneration which bile leakage has. There are some preclinical studies which suggest that liver regeneration could be impaired by bile leakage, but actually this hasn't been reproduced or shown in the clinical context yet. So what we did in Berlin was we assessed the course of liver regeneration in patients that had postoperative bile leakage and compared their course of regeneration with a matched control group of patients without bile leakage. We assessed liver regeneration postoperatively with the help of the LIMAX test. You probably might not know the test itself, so I will say a few words about it. The LIMAX test is basically a C13 breath test based on the liver-specific metabolism of C13 metastatin, which is metabolized by the liver to acetaminophen and 13-CO2, which is consequently exhaled via the lungs and detected by a special device. We already assessed the ability to detect postoperative liver regeneration in a previous study from the year 2012, and the results you can see here on the left-hand side. And what you get here is that liver function is reduced due to surgery, of course, but afterwards it has a distinct course of regenerations. And what you notice here also is that if a major complication occurs, as indicated here, with the dark green line that are actually deceased patients, the course of liver regeneration seems to be impaired severely. So as I said, we carried out a retrospective matched pair analysis, and we used a database containing 1,500 patients which underwent partial liver resection during the years 2004 to 2014. We actually had way more partial liver resections, but that were the ones where we had liver function assessment available. Of these approximately 1,500 patients, 126 presented with bile leak postoperatively, and 51 of that had sufficient data to include them in this retrospective analysis. From the remaining 1,400 patients, we picked 51 patients in a one-on-one matching to compare the results. If you look at results of our matching, it actually worked pretty well. If you compare the results of the post-operative bile leakage group, which is abbreviated here to PBL in the left column, and look whether there are any difference regarding age, gender, BMI, diagnosis, the surgical procedure, everything worked pretty well. There are no differences, no statistical significant ones at least. And something I really want to draw your attention to is the exceptional amount of extended resections we have here in this analysis here. Approximately 50% extended left or right hemiapatectomies in both groups, and the exceptional amount of bilioenteric anastomosis with 50% in both groups, because that are the patients where bile leak actually is most critical. Also, applied drainages were the same in the groups, and as you would expect, of course, intensive care days were longer in the postoperative bile leakage group and hospitalization as well. So here you see in this particular table the course of liver regeneration in both groups assessed with standard liver function parameters and LIMAX tests as well. I won't go into particular detail. This is actually just a selection. We analyzed more function parameters, but the ones who were significant, which showed significant differences between the groups here, were serum bilirubin and the LIMAX test. So let's have a closer look on these two. If you look at serum bilirubin, you notice that preoperatively there's no difference in the postoperative course, but you see that the bile leakage group actually has slightly higher values here on the 3rd, 5th, 10th POD, which also gained significance. So more interesting, the results of the LIMAX test, you also see preoperatively nearly the same function. Actually, the bile leakage group had slightly in mean a higher function. On the first postoperative day, the same function. Yeah, and then the course of liver regeneration starts in both groups, and what you notice here is that liver regeneration seems to be impaired in the bile-leakage group. Liver function is way more higher on the 3rd, 5th, and 10th and 14th POD in the matched group without bile-leakage, and is also highly significant. And by the way, you also get a nice regeneration curve, as you've already seen on the first slide. And that is basically the idea I want to conclude with. Dynamic liver regeneration is impaired in case of bile-leakage. This is actually the first clinical data which suggests that. And in our analysis, particularly LIMAX and bilirubin were able to distinguish these groups. And most importantly, of course, the delay in liver regeneration after partial liver resection is always suspicious for postoperative complications, for example, a bile-leakage, and this is why we recommend a postoperative monitoring of liver function, especially in high-risk cases. Thank you for your attention. Thank you.